Advances in medicine over the last 30 years have drastically changed healthcare in America. Many diseases that were once acutely life-threatening have shifted into chronic illness, which require different models of care. As a result, long-term care, a variety of services often provided by skilled nursing facilities for those who cannot care for themselves, is becoming a prevalent choice for the sick or disabled.
The long-term care continuum is one component of healthcare services today, and it includes occupational therapy, physical therapy, speech therapy, things like wound management, diet control, complex medical conditions that residents need 24-hour care to monitor. Skilled nursing care is an essential component within the healthcare continuum because there comes a point in a resident's life when they really need 24-hour care 7 days a week. And sometimes it's for a long-term basis for the rest of their life, and sometimes it's just for a short-term basis while they're going through rehab, and then they go back home and can take care of themselves for a while longer.
Established in Dayton, Ohio in 2000, Liberty Nursing Centers provide multiple levels of state-of-the-art quality medical services in a caring, person-centered environment. Its staff is dedicated to helping every resident achieve the highest level of independence and wellness possible 24 hours a day, 7 days a week, believing that a long or short-term care community should be a place where people live, grow, and call home. Liberty Nursing Centers care for both the body and the spirit.
Our mission is to provide the best quality care that we can in a cost-effective environment. We really strive to provide quality care in a home-like environment that centers on what the residents' needs and wants and personal needs are. After we determine what the residents' likes and dislikes are, we put all that together into a resident care plan, and that's then implemented by the staff.
Throughout its 15 Liberty communities in Ohio, Liberty Nursing Centers provides comprehensive services including long-term nursing care, short-term nursing care, rehabilitation care, behavioral health care, dementia care, and Alzheimer's care.
Skilled nursing care is covered by private insurance. In some cases, it's covered by Medicare, which is a federal program. And then for those residents who really have run out of resources, it's also covered by the Medicaid program, which is a state program.
Combining professional care with a personal approach, all Liberty Healthcare professionals share the same philosophy of caring, promote good health, enrich lives, and serve with compassion.
My father had a stroke in 2003. He was taken to a local hospital, and following a week of care there, we worked with the triage staff to assure a smooth transition to a quality skilled nursing facility. We chose Liberty. He has been here 7.5 years and has undergone multiple modalities of care with regard to physical, occupational, speech therapy. It's all been wonderful. It's been very helpful. His speech center was the most impaired, and most people will say that through the years they can understand him better. So the quality of that care has been excellent.
A few years ago, my mother had suffered some falls, and she had back surgery, and we decided to bring her to Liberty Nursing Centers for her well-being and safety. The level of care has been fantastic, from the nurses to the aides to the therapy department. Everything has been just wonderful here. I would recommend Liberty Nursing Centers to all families because of all the great therapy, the nurses, the staff. It's just been a great experience.
That's very rewarding for us and very rewarding for the staff when they get feedback from the families about how much they appreciated our caring staff and how much they helped the families during end of life or whatever the situation may have been.
I would highly recommend Liberty Nursing Center to others. As his daughter, I was not prepared to be his parent, and I depended on the people here to do that and to make him comfortable. It in turn made me comfortable, and just knowing that my role as his daughter and his dependent was able to sustain, and I didn't have to reverse that, which makes the quality of my visits much more enjoyable. It's a family environment here for Dad, and they love him and he loves them.
I've been very proud of the staff we've been able to bring together. Many of the facilities that I have purchased have been facilities that have been in financially troubled situations and really have needed help in getting their operations up to speed with state regulations and quality care. So we've developed quite a team. One building will help another when they need help, and we've evolved into a regional organization. I really think it's important for the public to understand what an important component it is in the long-term healthcare continuum as a whole. There are residents who can be cared for at home, but there are residents who need 24-hour care, need to be in a monitored environment, and those are our most frail elderly, and we cannot forget about that population when we're developing our healthcare continuum.
Some days, we all need a little help. Learn more about the skilled nursing care offered by Liberty Nursing Centers and become part of our family. For more information or to find a location near you, go to libertynursingcenters.com.